Hi, I'm going to continue with coronavirus false alarm. I'm going to start off from the paragraph I left off previously. Just to let you know that my videos are cutting off after 20 minutes, so I'm just going to make this video 20 minutes long. Okay, so New York was the centre of the epidemic, where more than half of the COVID-19 deaths nationwide occurred. Date May 2020. Most of the deceased lived in the Bronx, an emergency doctor reported. These people come way too late, but their reasoning is understandable. They are afraid of being discovered. Most of them are illegal immigrants without resident permits, without jobs and without any health insurance. The highest mortality rate is recorded in this group of people. It would be of interest to learn how they were treated. Were they given high doses of chloroquine as recommended by the World Health Organization? About a third of the Hispanic population carries a gene defect, glucose 6 phosphate dehydrogenase, that causes chloroquine intolerance, with effects that can be lethal. More than half of the population in the Bronx is Hispanic. Countries and regions can differ so widely with respect to a myriad of factors that a true understanding of any epidemic situation cannot be observed without critical analysis of these determinants. Corona situation in Germany. The German populace should have been reassured that this country was well positioned and that disturbing scenarios similar to those seen in northern Italy or elsewhere need not be feared. Instead, the exact opposite happened. The RKI issued warning after warning, and the government embarked on a crusade of fear-mongering that defied description. Anyone who dared to challenge the warning that the world was facing the greatest pandemic threat of all times was defamed and censored. The indicators for which measures were supposedly necessary or no longer necessary changed haphazardly according to demand. At the beginning of March, it was the doubling rate for the numbers of infection, which at first should exceed 10 days. But when this goal was reached, the rate had to be further slowed to 14 days. This objective was also quickly achieved, so a new criterion had to be issued. The production factor R, which supposedly told us how many people became infected by one contagious person. The authorities at first decided that this number must decrease to less than 1. When this happened in mid-March, they ran into difficulties and set out to redirect the number upward by increasing the number of tests. Excuse me, I'm just going to turn the light on. At the end of May, a bit of creative thinking led to the idea of defining a critical upper limit to the acceptable number of daily new infections, 35 per 100,000 citizens in any town or region. Now reflecting that performing just 7,000 tests can be expected to generate at least 35 false positive results. In total absence of the virus. Obviously, no scientifically sound reasoning underlay any of the plans and measures dictated by the authorities. It cannot be emphasised enough that infection numbers of no significance if one is not dealing with a truly dangerous virus Money and means should not be wasted on counting the number of common colds every winter. Arbitrariness and the lack of a plan wound their way through the measures. At the beginning, facial masks were scorned and not used, even in overcrowded buses, but when the epidemic was over, it became mandatory. DIY stores could stay open for business while electronic markets had to close. Jogging was okay, playing tennis taboo. Every state had its own catalogue of fines. There had to be punishment since we were dealing with an epidemic of national concern. But where was the logic behind all these measures? A closer look may help explain what had happened. The German narrative. Late in the evening of January the 27th, 2020, the Bavarian Ministry of Health announced Germany's first coronavirus case. An employee of an automotive supplier, a Chinese businesswoman, had been on a visit there 1 week earlier. The virus was subsequently detected in several other members of the company. Most had no symptoms, none were seriously ill. All were isolated and put in a 14-day quarantine. From then on, anyone returning from a high-risk area in China or Tyrol was tested and put into quarantine. A few scattered numbers of healthy cases were thereby discovered. Then came carnival season in Germany, and the Western German state of North Rhine-Westphalia is one of its centres where there is no holding back. The first coronavirus patient had partied in the middle of February together with his wife and 300 other merry carnival revellers in the district of Heinsberg. What's happened next sounded the national alarm. Coronavirus outbreak in Heinsberg. Many patients critically ill. Local hospitals overwhelmed. Schools and daycare centres were closed and all contact persons put in quarantine. At the beginning of March, the Minister of Health, Jens Spahn, still urged prudence. Mass events were cancelled, otherwise overall calmness reigned. But on March the 9th, alarm bells rang. The first coronavirus fatality in Germany occurred. A 78-year-old man from Heinsberg district and an 82-year-old woman from Essen succumbed to the virus. The man had a multitude of pre-existing illnesses, among them diabetes and heart disease. The woman died from pneumonia. Drosten warned against a threatening coronavirus wave. Autumn will be a critical time, that is obvious. At that time, I expect a rapid increase of coronavirus cases with dire consequence and many deaths. Who do we want to save then? A severely ill 80-year-old or a 35-year-old with raging viral pneumonia who would normally die within hours, but would be the worst after 3 days on a ventilator? But would be over the worst after 3 days on a ventilator. The pandemic is declared. On March the 11th, the World Health Organization declared the pandemic. The very next day, German governors of state voted to cancel all mass gatherings. On the same day, a report from France. All daycare centres, schools, colleges and universities had been closed until further notice. Germany followed suit 1 day later, and the German state ordered all schools and daycare centres closed from March the 16th. There was talk of a tsunami in the wake of which countless lives would be claimed unless we managed to flatten the curve. All of a sudden, everyone had a voice and an opinion, no matter whether astrophysicist or trainee journalist, and no matter whether they had not an inkling of knowledge about infectious diseases. Projections were presented every day. Exponential growth was explained to us on every channel, showing us how difficult it is to grasp or to even stop this development because the rate of infection seemed to double weekly. Without strict measures, there would have been 1 million infections by mid-May, according to the RKI. President Wheeler. The number of fatalities in Germany would soar up and approach Italian numbers within just a few weeks. For the first time, there was mention of a possible lockdown on the March the 14th. The Federal Minister of Health tweeted, "Attention, fake news. It is claimed and rapidly being distributed that the Federal Ministry of Health, federal government, will soon announce further massive restrictions to public health. This is not true." 2 days later, on March the 16th, further massive restrictions to public life were announced. Public life was rapidly stripped down. Clubs, museums, trade fairs, cinemas, zoos, everything had to be closed. Religious services were prohibited. Playgrounds and sports facilities fenced off. Elective surgery would be postponed. The primary goal, the healthcare system must not be overwhelmed. While alarmists was expanding here in Germany, alarmism was expanding here in Germany, someone else raised his voice. Someone who really knows what he's doing and whom we have heard of several times before, Professor John Ioannidis. Here is a summary of his article, "A Fiasco in the Making." The current coronavirus disease, COVID-19, has been called a one-in-a-century pandemic, but it may also be a once-in-a-century evidence fiasco. We lack reliable evidence on how many people have been infected with SARS-CoV-2. Draconian countermeasures have been adopted in many countries during long-lasting lockdowns. How can policymakers tell if they are doing more good than harm? The data collected so far on how many people are infected and how the epidemic is evolving are utterly unreliable. Given the limited testing to date, some deaths and probably the vast majority of infections due to SARS-CoV-2 are being missed. We don't know if we are failing to capture infection by a factor of 3 or 300. No countries have reliable data on the prevalence of the virus in a respective random sample of the general populace. Reported case fatality rates, like the official 3.4% rate from the World Health Organization, cause horror and are meaningless. Patients who have been tested for SARS-CoV-2 are disproportionately those with severe symptoms and bad outcomes. The one situation where an entire closed population was tested was the Diamond Princess cruise ship and its quarantined passengers. The case fatality rate there was 1.0%, but this was a largely elderly population in which the death rate from COVID-19 is much higher. Adding to these extra sources of uncertainty, reasonable estimates for the case fatality rate in the general US population vary from 0.05% to 1%. If that is the true rate, locking down the whole world with potentially tremendous social and financial consequences may be totally irrational. It's like an elephant being attacked by a house cat, frustrated and trying to avoid the cat. The elephant accidentally jumps off a cliff and dies. Could the COVID-19 case fatality rate be that low? No, some say pointing to the high rate in elderly people. However, even some so-called mild or common cold type coronaviruses that have been known for decades can have case fatality rates as high as 8% when they infect elderly people in nursing homes. In fact, such mild coronavirus infect tens of millions of people every year and account for 3% to 11% of those hospitalised. In the USA, with lower respiratory infections each winter. If we had not known about a new virus out there and had not checked individuals with PCR tests, the number of total deaths due to the influenza-like illness would not seem unusual this year. At most, we might have casually noted that flu this season seems to be a bit worse than average. The media coverage would have been less than for an NBA game between the two most indifferent teams. One of the bottom lines is that we don't know how long social distancing measures and lockdowns can be maintained without major consequences to the economy, society and mental health. Regrettably, this voice of reason remained unheard by our politicians and their advisors. Instead, the prediction ventured by Professor Neil Ferguson, Imperial College of London, made the headlines. If nothing is done and the virus allowed to spread uncontrolled, more than 500,000 people will die in the UK and 2 million in the US. Not only did this make the rounds, it struck fear into the hearts and souls. Incidentally, Ferguson is the same authority who predicted 136,000 deaths due to mad cow disease, 200,000 deaths due to avian flu, and 65,000 deaths due to the swine flu. In all cases, there were ultimately a few hundred. In other words, he was wrong every time. Do journalists actually have a conscience? And if so, why do they not check the facts before distributing their news? Naturally, here too it later became apparent that Ferguson's predictions were totally wrong, but this was never reported by the media. For the RKI, the headlines seemed to be just the right thing. It warned of an exponential increase. With this exponential growth, the world will have 10 million infections within 100 days if we do not succeed in curbing the number of new infections. Model calculations were published that predicted hundreds and thousands of deaths in Germany. Politicians entered a race for voters' popularity. Who could profit the most? Markus Söder, state president of Bavaria, presented himself as action man, emanating force and determination in front of the camera and declaring his intent to fight the virus to the finish with all the means at his disposal. Söder surges ahead with the first draconian measures, stay-at-home order for Bavarians as of March the 21st, no visit to loved ones in hospitals, no church services, shops and restaurants closed, among other incredible measures. I'm going to leave it there because we're at the 20-minute mark, but I will continue with this on another video.